Hi everybody, my name is Jenna Overbaugh. I am a licensed professional counselor here at OCD, and we know that so many of you resonate with the subtypes that you see online and that you hear about. So we're going to be giving you some more information and some more educational content about the OCD subtypes in particular. So for right now, for this video, we are going to focus on real event OCD. And we wanted to focus on real event OCD because a lot of times we hear from people, real event OCD seems a little bit different because this is something that actually happened. This is something that I'm obsessing over or doing compulsions over that actually happened in my life, that actually happened in my past. Whether it was, a couple days ago, a couple weeks ago. We work with people who sometimes have real event obsessions and compulsions about things that happened 14, 15, 20 plus years ago. Real event OCD is one of those OCD subtypes that really talks about how somebody could have obsessions and compulsions around an actual event that happened in their life versus other subtypes where somebody might be fearful of or afraid of something that could happen potentially in the future. Some obsessions that you might see in somebody who has real event OCD might be things like, did I actually do that? Or what happened in that situation? Or how did I feel about that situation? Why did I do that? Why did I feel the need to do that? That is going to create a lot of anxiety within that person. A lot of times that anxiety stems from moral issues and moral questions, like what kind of person am I? I need to know what kind of person I am. And by somehow, if I could just figure out this real event and how I felt during that event or what my intentions were, then I could figure out and know with 100% certainty what kind of person that I am. Some of the compulsions that somebody who has real event OCD might go through might include rumination, mentally reviewing, trying to go back in their minds and remember or try to recreate the scenario about what they remember or what they felt or how they acted. A lot of times they might even try to put somebody else in their position and try to navigate, how would that person have handled this? And, almost in a way to kind of get that reassurance that someone else would have done the same thing, or maybe that person would have done things differently. With real event OCD, see a lot of compulsions like reassurance seeking. So seeking reassurance from other people or even online about, what would you have done in this situation? You might also see a lot of confessing. So just verbally trying to get out the events and the details of that event in a way to kind of verbally figure it out for themselves or engage in some type of conversation. You might also see somebody just avoid anything that could be a reminder of that event. So if somebody else was involved in that event, you might see that person with real event OCD avoiding anything that triggers them of that person or anything that could be a reminder of that event that they're really struggling with. If any of this resonates with you, it probably feels so tempting and so urgent to have to figure something out, to have to go back into your memory and replay these scenarios and try to remember how you feel. And the unfortunate thing is that that's going to feel anxiety provoking. That's going to feel very urgent. Every time that you do that, it's going to reinforce your doubt for the next time. So research actually shows that the more that you go back and check something, whether that's a door or a lock or a faucet, the less confident you actually are in your memory. And while that seems totally unconventional and totally backwards, the same thing actually happens when we kind of check or go back and mentally review or ruminate about our own memory. The more that we go back in our memory and check memories and we try to replay events or try to remember how we felt about this event, the less confident we actually get about our memory. The more that you ruminate, the more that you try to go back and review, the more that you try to kind of finagle with these memories, the more fuzzy everything becomes, the more uncertain you become, the more doubtful you become, and certainly the more anxious, depressed, and stressed you become. Here at OCD, and when you're working with a specialist who understands OCD and who specializes in exposure and response prevention, we really emphasize educating you about all of these things. We educate you about the OCD cycle and how these compulsions may temporarily make you feel better and feel really urgent in the moment, but actually serve to just make everything worse in the long run and make you feel like you need to do more and more of it. Ultimately, at the end of the day, through exposing yourself and pushing yourself a little bit more and more outside of your comfort zone, in addition to reducing your safety behaviors and compulsions and reducing your avoidance, we can get you to a place of acceptance. We can get you to a place where you're able to acknowledge that real event without having to go back and sift through your memories for all the details. You're able to kind of move forward and take the next steps in your life without feeling the need to urgently go back and piece everything in the past together. As debilitating as OCD can be, research shows that ERP is more effective for OCD than any other treatment for any other behavioral health disorder. The right guidance and the right support that you can get here from NoCD, we can guide you every step of the way, and we can get you to a place where these symptoms no longer control your day-to-day living. If you would like to speak more to one of our care team members about our therapy services, you can reach out to us at www.treatmyocd.com and get set up with a therapist who understands and knows how to treat real event OCD.